Community Health Partner.
Sure, thank you. I'm Apple Martin. I am the current Community Health Division Director at Jefferson County Public Health in Port Townsend. I'm a nurse by trade, but I've worked in public health my whole career. I had the great privilege of getting to move here 3 years ago to take this job, and I've completely settled here. I have kids in this school district and will be a longtime resident here for sure. I am the outgoing Community Health Division Director as of this Friday, and I will be taking over as the overall director for Jefferson County Public Health starting next Monday. And I've worked with the school districts and the superintendents, principals, school nurses quite a bit through COVID in working with them behind the scenes around protocols and navigating all of these sort of challenging guidelines. So I really appreciate that collaboration, and I appreciate having an invitation to attend tonight. Thank you.
Thank you for being with us. Shelby.
Shelby McMeekin, and I am the Director of Student Services here in Port Townsend. And I'm proud to be the Director of Student Services, and I oversee special education services, and I head up our district wellness committee. In addition to that, I work with students, at all levels, and I'm excited to be a part of this committee.
Thank you, Shelby. Tori.
I'm Victoria Kelscher, and I'm the new principal at Blue Heron Middle School. And I just really want to say how much I am thrilled to be here starting this journey with everyone. So welcome tonight, everybody, and thank you for attending.
Thank you. Sarah.
Hello, I'm Sarah Rubenstein, and I am serving as the Ocean Principal and the Online Program Director this year, and transitioning out of some roles that some of you know me in, working in communications in the school district.
Thank you. Carrie.
Good evening, everyone. This is Carrie Earhart, principal at Port Townsend High School. And along with everyone else, just happy to see so many folks here tonight. And we're happy to share this information with you in this continued unusual year.
Thank you. Lisa.
Hi, I'm Lisa Condren. I'm the principal of Salish Coast Elementary, and I'm also very happy to be here with all of you tonight. Thank you for coming.
Thank you. And I'm Superintendent Linda Rosenberry. Welcome to the COVID Protocols webinar, where we'll talk about keeping students safe and in school. The flow of tonight's session is our welcome that we just had. We'll do an overview of the protocols that are based on the state guidelines, and Port Townsend Schools has created our health and safety guidelines, which you can click on the link there. It's also what we've sent out to parents the past 2 weeks, really making clear what we're doing here as a school district. The slides will be a lot of the same language from the health and safety protocols with some images to make them come to life. You'll see that we disabled the chat. That's because we know there will be lots of questions and comments. So instead of using the chat where things can get lost, we're using the Q&A button. If you click on that, you can ask a question or make a comment, and then any one of our panelists can answer you, and then that will become visible to everyone in attendance tonight. So please feel free to use the Q&A. We have many panelists here, so hopefully we can keep up with your questions. And we will be using a lot of the language from the existing documents. So if it feels a little technical, the answer you get back, that is because we're trying to make sure our language is consistent. So it might not be someone typing off the top of their head, but instead copying and pasting from one of our documents to make sure that we're clear and consistent. We also are recording this webinar, and we'll post it on our school website. So thank you all for coming. I'm going to start with some slides. It probably shouldn't take more than 15 minutes. And then during that time, if you have questions about a slide, feel free to put it in the Q&A, and one of our panelists will answer it. And then when I'm done with all the slides, Sarah Rubenstein will let me know what happened in the Q&A, and I can answer questions live and touch on any themes that seem very, people had a lot of interest around. So I mentioned our state and county guidance. Most of what you hear tonight is coming directly from Washington Department of Health, also our Washington Interscholastic Activities Association. I also meet regularly with the county health officer, Dr. Allison Berry, and as you were just introduced to, our community health director, Apple Martin, who's also a parent here at Port Townsend School District. And we're happy to have her here and to partner with medical professionals to determine how to keep students safe and in school. So as you probably heard, vaccinations were mandated for all staff, volunteers, and contractors. They're not mandated for students or visitors. So if you're a family member who's not vaccinated and you want to have a meeting in the school, you can do that for sure. You don't have to be vaccinated to still participate in your children's education. You would just sign in, check in, and sign in at the school office. If you have a question specifically about your school and how you get an appointment or how you come into the building, you can put that in the Q&A and you can write for Blue Heron or for Salish Coast, and then the principal who's on the panel will know to answer that question. Student vaccine status, we are collecting that in Skyward because it helps us implement protocols. You probably saw over the weekend that we had a positive case at Port Townsend High School. And so it helps us to know when we're researching who might have been exposed, how many of those students were vaccinated or unvaccinated. And you'll see that later in the slides, why that's important for our quarantining protocol. And I want to thank Brandy Hageman for getting vaccinated. She's right here in the picture that was on the cover of our student newspaper. We are still doing wellness screening each morning for all staff and students. Here is the current list of symptoms for COVID-19. If you have any of these symptoms, please stay home. Temperature check is very important. We're no longer doing it at the door because it's no longer required by the state, but we trust that each family is doing it at home. And if you need a thermometer, please check in with your school nurse and we can provide one. Masks are required for all people indoors and for crowded outdoor spaces. So you see the jungle gym here. There was conversation about whether the jungle gym was a crowded outdoor space. I observed it yesterday. It is. And the students did a very good job of keeping their masks on during that time. Some outdoor spaces, the masks might not be required. For example, at Port Townsend High School, when the students are changing classes, if they're sitting by themselves or far away from other students, they might take a mask break and put it down under their chin. We're closely monitoring students and masking to make sure that they're in compliance. Some staff was concerned that students couldn't hear them through the masks. So you'll see a picture down here of a voice amplifier that we've purchased for our teachers to make sure that they can be heard in the classroom. We're practicing physical distancing on our school buses, in our classrooms, outdoors, and at lunch. You probably heard that the physical distancing this year, as per the CDC, for students is 3 feet, but at lunch where it's unmasked, it is 6 feet. And the physical distancing for adults, so an adult to a student, is still 6 feet. Ventilation is so important for COVID mitigation. So indoors, we have windows open, fans, and our HVAC settings circulate outside air. We've also gone above and beyond the CDC guidelines and are purchasing air purifiers for all of our classrooms and offices. In the winter, when we might not be able to have our windows and outside doors open, our indoor heating ventilation meets standards for CDC. If you have any specific questions about our HVAC system, our MERV 13 filters, you can reach out to our Director of Facilities, Justin Gray. And if one of our panelists can put his email in the chat, that could be helpful to those at home who might have deep questions about ventilation. Also, ventilation is much better outside. And as we know from how the virus transmits, it's better to be outdoors whenever possible. So you see down here a red tent, that's from Lila's Kitchen here in town. We have purchased tents of the same design that could withstand up to 80 miles per hour. They will be outdoors at each one of our schools in the color white. Here you see a picture of our 5th grade students at Salish Coast helping wheel the tables in yesterday after lunch. So we're all coming together as a community and making sure all meals can be outdoors. And I've seen classes outdoors, meetings outdoors. If a teacher asks you to meet with them outdoors, please know it's just part of our common practice in order to mitigate spread. Hand hygiene is so important. Here you see a Salish Coast student using one of our additional sinks. We're making sure that there's frequent hand washing upon entry, before and after eating, after using the bathroom, before and after recess and PE, and there's hand sanitizer available that's at least 60% alcohol. A new thing this year that I'm very excited about is this tool that we have, rapid antigen testing at school. And here's a picture of the rapid antigen testing card. And down at the bottom is a picture of a student. You may have watched this video I shared a couple weeks ago. He's using a self swab, and then trained staff are putting that swab into the card here. And within 15 minutes, there is a response. Right now, it says results within 15 to 30 minutes via text. That is once we have the whole system up and running. For now, if you've completed the annual consent form in Skyward and your student is willing and agrees to a swab, we will do that in school and notify you of the result. If you didn't complete an annual consent form and have questions, feel free to put that in the chat now. And if you did complete an annual consent form in Skyward, but we go to test your student and they seem very uncomfortable, please know we won't be forcing a test on any student. We're trying to use it in a positive way as a layer of protection for students, but we know that testing at school can sometimes not feel good. And so we're working our best to respond to student needs as they arise. You see here a football players here. Those are the Chimacum Cowboys and the Port Townsend Redhawks. They had their first joint game as the East Jefferson Rivals on Friday night. All of our cheerleaders and football players were tested before the game and were all negative, and we had a safe and fun night. This started last year with Port Townsend High School graduation. You see 2 students here unmasked because they took the test. You might wonder about the accuracy of these tests. So they are rapid. So the accuracy is in the low 90s, unlike a PCR, which is the other type of test where it's 98 to 99% accuracy. So if you do have a positive result from one of these rapid antigen testing, we retest, and then there is a PCR confirmatory that can be done outside the school. Apple, do you want to fill in anything about testing? Because you're probably more of an expert than I am on this.
I don't want to fill in too much because I don't want to create any confusion. I think what you just said is accurate, and I'm really wanting to applaud all the school districts for onboarding this on-site testing. This is a huge improvement for everybody. I appreciate the way you've explained that, Linda, and I encourage all parents to get those consent forms in and have that available. Otherwise, technically, I think this is one of the signs that ubiquitous testing is really the wave of the future, and we are getting a lot of response from that. In public health, we have a smaller contingency of folks that we provide tests to, but in the school setting, it's really helpful to have those tests available when kids are at school. They may develop a symptom during the day, or they might find out that they were potentially exposed to someone who has tested positive, and having that immediate response to get an initial result is really, really handy, and it's happening all over the state right now. So I appreciate your effort around this. And I don't think there's any more details that are relevant to the school itself. I will say that public health is responsible for doing case investigations as they connect with the community at large. Where there's some positives that go on in the schools, we will be in charge of sort of furthering investigations that as they result out into the community. But the schools really this year have taken on this incredible task with some support statewide to be able to mount this effort internally and on site. And it's the best possible scenario we can think of, truly, to keep kids in school.
Thank you, Apple. So our response to positive cases, if it happens, we identify and notify close contacts. For adults, that's defined by within 6 feet for a total of 15 minutes cumulative over a 24-hour period. Note that the infectious period starts 2 days before the onset of symptoms. So if we do find out that a person that's been in our building tested positive, we find out the day their symptoms started and go 2 days back to figure out who they may have been in contact with. The CDC's new guidelines for close contact for students excludes students if they're at least 3 feet away and both are masked. But if they're not masked at any time indoors, or if they're within 3 feet, they will be considered a close contact. And we're tracking seating charts and bus seating charts and any other activities that happen to identify close contacts. And if we're not quite sure if that student was fully masked or within, we're erring on the side of caution and identifying them as close contacts. Close contacts do need to quarantine and until they go through a regimen, which I'll tell you about on the next slide. In addition to close contacts, our district is recognizing that some families were concerned about 3 feet because last year it was 6 feet. And so we are also identifying those possibly exposed who were within 6 feet indoors, but no quarantine will be required for those staff members or students who were within 6 feet because they are not considered close contacts. These definitions may evolve as the virus evolves and as we have more case studies. They were based on last year's data from the CDC, which was before the Delta variant was huge in this county. And that's why we are identifying those possibly exposed in addition to just close contacts. The possibly exposed definition is also based on an outbreak that occurred in Marin County, California. And there, though, the teacher was removing her masks at times. So we're closely studying any cases where there was in-school transmission to make sure we don't have that in Port Townsend. Last year in Jefferson County, there was no in-school transmission. We want to keep it that way this year with our mitigation strategies. As you may have seen last weekend, when we have a positive case, we notify the entire school community. So you'll receive an email from me and our dashboard will be updated. You may hear about a positive case in the community, but wonder why you didn't get an email from the school. That would mean that that person was not in the school building during their infectious period. So we're only reporting on positive cases that were physically in our building or part of an activity at the school, not community cases. So here is our flow chart from Jefferson Healthcare. So if you have any of these symptoms, you should test for COVID-19. If you don't have these symptoms, but are considered a close contact, if you're not fully vaccinated, that is when you would quarantine for 10 days. And if you're fully vaccinated, and if you don't have symptoms, you don't need to quarantine. You have to wear a mask, everyone does right now. And then you would test 3 to 5 days following exposure. So with the positive case over the weekend, we did test all students who were close contacts or possibly exposed, if they were fully vaccinated or not fully vaccinated. And we were fortunate that they were all negative, or else you would have received another email from me about a positive case, which we're trying to avoid with these mitigation strategies so we can keep kids in school. Apple, do you want to add anything on this slide? And I know you have to head out in a couple minutes, so if you have any parting words for the group here tonight.
Sorry about being muted there. I'm going to put a link to this flow chart in the chat, and this is for the school testing. So we have on our website with Jefferson County Public Health, we have 2 flow charts, one for the public at large and one specifically for schools to follow. So I will put that in the chat. I do have to leave soon. I'm sorry I didn't say that sooner, but I don't have anything to add to this portion. You've explained it well.
Thank you, and we'll keep working closely together. I think I missed a slide. Yes, instruction for absent students. So we know that in the era of COVID, we might have more students who have to stay home, whether it's that they tested positive, but they feel well enough to learn, they're identified as a close contact, or if they have one of those symptoms and are awaiting test results. So the process this year for instruction for absent students is that first, the classroom teachers provide the work. For most teachers, they are having the work available on their e-learning site. And here's a picture of the Blue Heron Middle School e-learning site, has a link to Google Classrooms. The playlist, last year, all teachers did the playlist. It worked really well for some teachers and they will continue the playlist. Other teachers might direct you to the Google Classroom, or if it's a K-2 student, to Seesaw. The teachers will be busy teaching the kids who are in person. And so we are providing another layer at the district where we'll have daily office hours with teachers on Zoom from 9 to 11 a.m., Monday through Friday. So any student who's absent and wants support with the work that the teacher provided can log on to Zoom during those 2 hours, drop in and get support. If those 2 hours don't work, you'll also have an opportunity to sign up for an appointment at another time with a teacher. So we will be sending out this information next week when it's up and running. And if you do have to stay home from school for a period of time because of a COVID close contact, we will share this information you at that time as well, so you have it at your fingertips. So with that, I am going to stop sharing my screen so that I can see everyone and see what questions arose, if there's anything that I could talk further about, or if anything specific to a school principal.
So there's one question that we might not have the answer for, but it's good to still bring that up. Why is the physical distance for vaccinated adults 6 feet and potentially unvaccinated students 3 feet? What is the science that supports that?
So this question was asked specifically of Dr. Allison Berry, our county health director, and it was based on last year, the 6 feet quarantine led to many students missing school and they never contracted COVID. And so I don't know if there's COVID science that supports 3 feet, but there's a lot of research on mental health impacts of students missing school and lost learning. Because I haven't seen the COVID science that supports 3 feet versus 6. That is why we have identified also possible exposure and providing testing to those students and notifying families so that they can be on the lookout for symptoms.
Great, thank you. So there's another question about a new student, a kindergarten or a pre-K student that isn't seeing that consent form in their Skyward account. So it's great that we have families wanting that consent form. Lisa Condren will follow up to make sure we turned on those forms. There are paper forms for anybody who Skyward can sometimes be difficult to access. And so if you're having trouble accessing the form on Skyward, but you want to get that consent in for your student, any of the school offices can give you that paper form as well. But so here are some other good questions. What point do administrators decide that COVID rates are too high and they're shutting down to in-person classes? Maybe that's one you can start with, Linda.
Yes. So because there was no in-school transmission of COVID last year in Jefferson County, the decision was made to keep schools open and in person because we were not contributing to the community COVID rates and the hospitalization rates. If we see that COVID is being transmitted in the schools at a pace that we as leaders can't keep up with, that is when we might move to a different model that would allow students to be further apart during the classroom day. So if there is an in-school transmission, we will study closely what caused it and how we could prevent it in the future. And if at any point we feel overwhelmed, like we can't prevent COVID from being transmitted in the schools, that is when we would make the decision to move to remote instruction or to a morning and afternoon cohort. None of that has been decided yet. I'm just letting you know potential possibilities and what the process would be. We're hoping this year that we can do what we did last year. Our staff is very strong. Our students are very strong. They're wearing their masks. They're keeping their distance. And we have a district COVID team that is quickly contact tracing, testing, quarantining. So I'm hopeful that we won't have a lot of in-school transmission. If we're getting close to that, if we start to see in-school transmission, we will partner with our label partners, the teachers union, families, students, and we'll talk about how can we make it safer in school based on what we know about how the cases did transmit. But I'm hoping that won't happen. And Dr. Berry, as the county health director, she knows that the schools are not what's contributing to the COVID cases or the hospitalization. And so hopefully we can keep schools open throughout this process and our little ones can get vaccines by November or December. And that would be very helpful.
Great, thank you. This one might be one for Carrie to provide some answers to. So Jane says, thanks for our incredible work. So I just want to say that. So there's a lot of appreciation, but can we share information about preventative testing for student athletes?
Yes, so the WIAA has put out some guidance recommending different sports that are either potentially high, medium, or low transmission to have these tests. They're not required, they are just recommended, which is why some districts are choosing to test and other districts aren't. So in our collaboration and partnership with Chimicum, we felt that it was important that we do give those tests to our athletes just to make sure that they are safe and healthy. So for most of our sports that are being tested, for example, football and volleyball, they are being tested as fall sports once a week, whereas cheer, it is recommended that they be tested twice a week. So we are following those recommended testing guidelines for the health and safety of our athletes and our opponents that we play.
So Carrie, there's one more sports question that maybe you can answer, or maybe Tori, because I think this is a middle school parent. Will parents be able to go into the gym to watch games such as volleyball?
So at this time, there are fans that will be allowed in the gymnasium. One of the challenges is that we have to maintain that 6 feet of distancing in our gym. So prior to the first game, seats will be marked off, and we already know about the number of students or fans that will be allowed. The capacity is pretty close at both Chimacum High School and Port Townsend High School. It's around 48 to 50 adults that will be able to attend a game. So we're still working on what would be the protocol to allowing some priority maybe to families on some games. Other games we might just want to open it up to the general population. So we are still working on that. And yes, there will be fans in the stands, but there will have to be a limit. And then of course, fans will have to be masked the whole time. The other thing is, because of the COVID precautions, we will not be able to sell concessions in the indoor. So you would just be coming to see the game.
Because I know that was a middle school family. I'm wondering if there's different answers or the same answers for middle school, if we know yet.
It would be the same answers for middle school.
Mhm.
Correct.
I'm hoping that we can increase capacity soon, but right now Jefferson County is experiencing the highest rates ever. And we thought vaccinations would protect us, but in the state of Washington, there have been nearly 22,000 breakthrough cases where vaccinated individuals have contracted COVID. So at this particular time, we're being extra cautious in hopes that we can stop the spread of the virus and that we can soon lift some of these layers of protection. But for now, we want to make sure that we're putting them in place so that we can keep students in person and safe.
Great, thank you. So we'll move on to some other topics, but there's some more sports questions. So we'll take a break and come back to sports. So another parent asked, just curious if we know what percentage of students are vaccinated at Blue Heron Middle School and Port Townsend High School.
We just started collecting the vaccination status. And so I don't feel comfortable sharing. I don't think we have a good enough sense of those two schools, but I know that in the county, I believe the rate for teenagers is around 50% vaccination. And so that's why we are encouraging all those eligible to get vaccinated. And we are offering, there are many places where vaccines are free, and we're hoping more of our students will get it and turn in those forms. So later in the month, we'll have a better idea of that number, but right now we're still working on processing all the paperwork and getting all the families to upload it to Skyward.
Great. So another family said 3 cheers for Port Townsend School District staff. Thank you for helping keep kids in school. Curious about why we are not doing the pre-screening check on Skyward this year.
So as the new superintendent, I saw that it was no longer required through the state. And from talking with families and others, we weren't sure if it was worth all of the technical hassle that I heard from families about going in and clicking. And so we decided that that technical step wasn't as required. But I would love, if there's a principal, Lisa, if you could answer why at Salish Coast, what happened last year and what we're doing differently this year and why. That would be helpful since I'm new here.
Certainly. Well, we are very much stressing to families and students both that you are supposed to check for all those symptoms before coming to school, and that if you have any, you should stay home, and also to take your temperature coming before school. It was kind of a big process that took a lot of people to do, and it honestly, we never actually were able to catch a high temperature. We never caught a high temperature through all of the thousands and thousands of temperatures we took. And there were some challenges with needing to have the students come into the gym to get warmed up enough so the thermometers would work properly. I think if it had been a more effective process that helped us catch 6 children that were sick or had elevated temperatures, it would be worth continuing doing. But I think it caused families a lot of trouble. And then sometimes we also had kids whose families forgot to do it. And then when we couldn't get a hold of them, they couldn't come to school until we were able to get a hold of a parent. And that was sometimes really hard for kids too.
Great, thank you. Will there be random testing of the student and staff body?
We are considering random testing. We haven't launched that test right now, and there is a shortage of tests, but Principal Condren and I have been in talks with the Washington Health Commons, our partner on testing, and there's a new provider that we are considering who would come and bring people who would administer tests and screening in that way. So we'll keep you posted on that. And if we see transmission happening in school or rates continuing to rise in the community, we will consider that even more. But right now we're hoping our rapid antigen testing will be sufficient for those who are symptomatic or possibly exposed.
Great, so the next question is there a possibility the district would require COVID vaccines for students to attend in-person school?
That would be a decision from the state. So OSPI, the Office of the Superintendent of Public Instruction, that's the acronym, OSPI would be the one to make that determination. Just as the governor made the determination for vaccination mandates for staff, it would similarly come from Washington State. That would not be something that our school board would decide locally.
So we're going to go back to sports because we love sports questions here. So when we were talking about the testing, 2 families had questions about boys tennis and girls swimming and whether they would be tested weekly. So I don't think our answer identified specific sports.
So as I said earlier, the WIAA does divide up the sports and how often it is recommended that students be tested, the athletes be tested based on the likelihood of transmission. So for example, swimming is actually not required to be tested at all. I don't believe tennis is required to be tested at all. The difference in the transmission rates, they look at a couple of things. They look at the likelihood of close contact. So for example, wrestling is in the high probability that there could be transmission of exposure. So when we get into wrestling season, we will be testing wrestlers, I believe, twice a week, whereas those sports that are less likely to have those particles transmitted, they're either once a week or in some cases not required at all.
And I just posted in the chat the WIAA and Washington State Department of Health COVID regulations as they relate to sports. And if you scroll to page 2 and 3, it describes the categories for each sport, as Principal Earhart said, based on how likely COVID is to transmit based on the nature of the sport.
Right. So follow-up question about required student vaccines. So would there be an online only option for students if the vaccine were required for students?
Sarah, do you want to take that one?
So I can share for this year, we're running a 1-year pilot of our online program. We're going to evaluate in January how that program has been successful and whether there's ongoing need for that program just beyond COVID. Right now, we really did that program in response to knowing some families needed to make a decision to keep their students home for online learning this year. So depending when that determination was made, would play into the decision by the school board about whether we might continue to offer that online learning program. So that's certainly something you can pay attention to as we talk about board meeting agendas, if that's something that's important to you to communicate. And I also would welcome families can reach out to me, and I'll put my email in the chat in a minute, or someone can do it for me, and could learn more about our online program. And then if that was ever something that needed to happen this year, to talk to me about whether there would be space for their student during this school year.
And please know the board and I are very focused on responding to family need. We want to make sure there's a place for every student in Port Townsend School District. And that is why we're piloting this online program. And thank you, Sarah, for getting it off the ground, up and running. We have 45 students now enrolled. And I'm looking forward to supporting the success as that program is piloted.
We are responding to the last question with a chat response. But we have some time for a few more questions. If there's something you didn't get answered yet, and we're hoping someone else was going to ask that question, so you didn't have to, now's a great time to put it in the chat. And we can make time. We'll give people a minute in case they have more to add there.
Oh, I see the question in the chat. Shelby's typing about the air filters. I'm hoping they come next week, right? Okay.
So we're hoping our air filters will be here very, very soon to put in the classrooms.
Mhm. So if there are no further questions, I would just want to thank everyone for being here. Thank you, panelists, principals who've been working so hard every day to implement these protocols and make sure your students and staff are safe. Thank you so much. To all of our families who logged in today, thank you so much for partnering with us, doing those daily wellness checks, keeping kids home from school if they're sick, and giving us ongoing feedback. As you heard throughout my slides, when I hear from families something they're concerned about, I want to do the research and respond. So please keep reaching out to me or anyone if you have concerns about our protocols, and we will work hard to make sure that we keep kids safe and in person. This webinar will be posted on our website for anyone who missed it, or if you want to review anything. And the health and safety guidelines are also on our website, which is a detail of the things that we discussed today. So with that, I want to thank everyone again for a successful start to the school year. And I want to thank you all for your patience and flexibility as we continue to operate in this new world of the Delta variant. Please stay safe, keep your family safe, wear masks. If you're eligible to get vaccinated, please do. Distance, stay outdoors. That will help bring these rates down so that we don't have to have such strict precautions in the schools. But for now, we're going to keep these layers of mitigation to make sure students stay safe and are in person. Thank you so much. Have a good evening.